we have to look at two sides of the fence when we're looking at a nursing education. You will be prepared to function at that level of thinking as a bachelor's prepared nursing professional. And then of course you'll get your licensure. Part of that preparation as a bachelor's prepared nurse is that thinking level, so that you will practice at the very highest level of your licensure. And that partly has to do with your foundational courses that you will have completed, in arts and sciences, and then adding, the nursing content going up into that 400 level courses. So you're going to be prepared in all that knowledge component. And then I'm going to have Alaina talk about how you're going to be prepared with the skills. And then that all comes together to think about, you're thinking like a bachelor's prepared registered nurse. They come together with how you think about your nursing career. So talk about the skills.
So throughout this curriculum revision, I think it's been an interesting collaborative to see the nursing faculty, obviously all nurses with nursing experience and being on the clinical unit, seeing what it takes to be a nurse today. And so those conversations of, what did our curriculums look like, and what did we feel like we needed as a new nurse, and what do we feel like nurses need today? And so I think those conversations were really great to discuss. What do our students need? What do new nurses need? And I think we've figured out and collaborated what those needs are, and we've been able to look through the current curriculum and figure out how to better prepare our students moving forward. Looking at the skills, we've had lots of discussions about skills across the curriculum and building courses on each other so that there's foundational knowledge and the students are building from that. The baccalaureate essentials will be changing, and the NCLEX test plan will be incorporating clinical judgment and really focused on testing students on their ability to make clinical decisions. And so we really wanted to look at, are there places where we can enhance that education for our students so that they can be better prepared for practice? I think also in evaluating our curriculum, we're really looking at our pass rate, and we want to have as many students be successful on the NCLEX that first time as possible. And so we tried to critically evaluate, where can we help students be more successful on that licensure exam.
We have noticed, and we constantly work with our students with regards to pharmacology, of ingraining not just the safety components. We want them to have the knowledge and of course the application skill, but also thinking about that safety component. And what the other thing that we do is always analyze our data. And our data continuously showed that we can enhance student learning more with regards to pharmacology. And part of that has to do with our ATI testing, which is our standardized nursing testing. Then that data also shows that we can enhance those components and concepts more, and we will be doing that. We do that in our courses now because testing always includes pharmacology, but just to enhance it as a focus on the clinical reasoning about taking care of those bedside or community patients. This will just help them perform better.
So knowledge of medications in our courses will have the patho. So what does this do for the patient that's taking that medication? Why do they need that medication? The two pharmacology classes will allow students to take a pharmacology in their first semester and their second, and currently they take it in that second semester. So hopefully they can get an introduction earlier on and be practicing that skill in their first clinical. So those three courses covered a lot of material, but most of it was introductory. And so we took the N120 course was health promotion, and that course covered education and the client, growth and development. And so we added a growth and development course. So really, we took the three courses and dispersed the information, but really into two courses. So we have an introductory course, and that will have their introduction to nursing. We've made sure that ethics is covered throughout the curriculum, as that's an important topic in the beginning, and throughout. Not something that they can forget about, and definitely something that we want to build on. And then that health promotion, the growth and development part of that will be covered in a nursing focused growth and development course that will look at all of those pieces that were covered in Ed 120. Our health assessment, we saw that assessment is a foundational skill of a nurse. Even beyond starting IVs or passing meds, assessment is really the thinking process. Being able to look at your patient and understand what is normal and what's not normal, and asking the questions why, putting together all the pieces of the data and being able to advocate for a new order or some follow-up with a physician. So assessment was a piece that we felt like we need to really strengthen, and so we did actually add lab time to assessment. But other than that, the clinical hours and the experiences are not going to change. The heart of the whole curriculum revision was what's best for the students. And that was said so many times that now everyone's like, is that best for the students? But I think it was so true, and I think it was a great opportunity for us to reflect, even people who have been nurses for 20 and 30 years and maybe haven't been in the clinical unit, lately they were saying, oh, I wish that I would have had a medical terminology class, or I wish that this would have been more beneficial to me, or, everyone just collaborating, like, this is what I teach in my course, what do you teach in yours, and how can we bring those concepts together or bring them throughout the curriculum? And so I think that everyone is dedicated to helping our students be, safe and confident. And I think we all have a vested interest, because at some point we all will experience healthcare ourselves or our families. And so I think we understand that there's a lot of responsibility and accountability that comes with nursing, and we want to help our students get there to be safe, confident practitioners.